There are different opiates that we can prescribe, but they're certainly not without side effects, and people are becoming more aware of this. So some of the opiates we use, there's one called buprenorphine, there's one called tramadol, morphine can be used, but once again, they're not without side effects, and a lot of times these pharmaceutical drugs irreversibly bind to receptors, and what happens is they get damaged in the body. So something like a natural component, like a CBD, some studies that have been shown, and certain herbs, they irreversibly bind. So they'll bind to the receptor in the body, but it doesn't damage that receptor.
So for the lay people out there are pain receptors in all mammals.
Correct.
Right? And so pharmaceuticals, you're saying, can dull pain, but they destroy the receptor?
Oftentimes they will permanently attach to that receptor and then eventually destroy it. So we have a natural endocannabinoid system in our body and receptors in different areas. So there's more in the brain as far as CBD1, and there's some other ones in the skin or the GI system, and they're more CBD2 receptors. So there's a lot of benefits for its use throughout the body.
Okay, so to summarize that, traditionally, doctors of human medicine and veterinary medicine have prescribed opiates for pain killing.
Correct.
And there's there's side effects.
Correct.
So now I think what the public is experiencing is they're hearing a lot about CBD, which is a form of cannabis, as an option. Are there any concerns about their animals getting high, or can they?
So I think the important thing to remember is that cats and dogs have significant amounts of where THC would bind, so it's extremely toxic to them. The CBD component of it, which is the non-psychotropic component, so it's not going to get them high, it has there's a lot of therapeutic benefits for that. So you have to be very careful that you're not prescribing something that a human's taking that they might want to experience a bit of a high, or that has a higher THC component. That would be extremely toxic for the animals. And this is what I'm finding challenging, because without veterinary direction, which I hope we're included at some point, you're going to see a lot of issues with toxicity, because people are going to take it into their own hands.
So patients are doing their own research. They hear that cannabis is good for pain, and then they want to give it to their dogs, because all pet owners don't want their dogs to suffer.
Exactly. So what happens is, if they don't have the proper direction from a professional like a veterinarian or their doctor per se, and there's certainly human doctors now, there's more and more that are willing to prescribe it, what's happening is that they're just kind of Googling it or saying, well, if I take a syringe full, my dog might only need half a syringe full, and then you don't realize that the concentrations really affect them differently.
So it seems as though a human doctor, to use that term, can now prescribe cannabis for pain, but an animal doctor can't prescribe cannabis for pain.
No, we're limited at this point. We're certainly trying to advocate for that shift, because I think there are tremendous benefits. What I would suggest at this point, because I can't legally prescribe or talk about dosages, is consulting with perhaps a human consulting company for cannabis.
So the knowledge is out there. It's just that you're not allowed by the college to give advice to the patients who come in asking about cannabis.
No, I'm not.
Right? Are you allowed, though, because you spoke about toxicity,
Yes.
Can you at least warn them that
Absolutely.
Using cannabis from a dispensary or from an online place has a risk? Will the college allow you to give that warning?
I think the college, because veterinarians are here to serve the public and their patients as well as their clients, I think the college is supportive of us being able to warn them of the dangerous effects of it. So absolutely. I think that making them aware that THC is toxic for pets is completely legal, and actually I think the college would support that.
Yeah, because you could say anything is toxic for pets.
Of course. I mean, it's not without side effects. I mean, there's pharmacological toxicities, there's plant toxicities, household toxicity. So one of those is a THC toxicity, and we often, I've personally seen it in the past where a pet has consumed a large amount of cannabis that contained high levels of THC, and they were hospitalized for that.
So somebody comes in with their pet that's experiencing pain, you can tell them not to use cannabis with THC, but you're not allowed to tell them that they can use cannabis with CBD.
Correct. I cannot direct them on how to use it. I have, however, seen people that have come in and have taken it into their own hands with respect to treating their pets. And my experience has been that there have been many therapeutic effects, from osteoarthritis to just even anxiety, or pets that are having issues at home with ear problems or skin problems. And certainly if they come in to me and say, listen, I usually want part of my history gathering is what supplements or treatments do you currently have? Because I need to know how to be able to treat them further. And oftentimes that's already on board, and it's not my position to say, oh, you can't use that. It's their choice. It's their animal. Mm-hmm. So for me, what I've seen up until now is that it's been very therapeutic, and they're for various things. So as a doctor of veterinary medicine, I have seen tremendous improvements with animals, particularly with ones that have not had a good appetite, that are starting to eat again. And oftentimes a lot of this stems from chronic inflammation and chronic pain. Mm-hmm. So if you can alleviate that, you're going to see improvement. So CBD oil itself, minus the THC, has worked extremely well in patients that have, clients that have chosen to do that for their own pets without my direction. They come in, they're already on it. They just want to let me know that this is working and they don't need the opiate or they don't need the non-steroidal. So for me, it's my job to support them, but also educate them on the toxicities involved if you happen to get a strain that's high in THC. Sometimes they want to experiment. Oh, what about this kind? Or perhaps, there's a lot of different strains out there and a lot of different areas you can obtain this from. And I think that making sure it's medical grade and that it's not full of pesticides is key, because they affect animals just like they affect people. And if they're ingesting that, it should be something of a pure source.
So people come to their veterinarian to get this advice on how to take care of their pets. There's nothing, and is there something on the college website that at least says the warning about THC or gives them any advice whatsoever, or what are people left to do? So
what I suggest to a lot of clients that come in wanting to know more about it is going to the college website, the College of Veterinarians of Ontario, and searching CBD oil and its use in animals. Mm-hmm. They kind of outline the rules that we have to follow, but also some guidance for the public. Mm-hmm. And that's usually updated, and that's probably where they're going to get the most information as far as keeping up to date with things. So once those laws change and we're included in that Cannabis Act, I think there'll be a big shift, because people want it for themselves, so they also want it for their pets. And when you can see the benefits of it, it'd be nice to be able to at least support them on that decision.
Maybe you could go a little bit more in terms of capturing, the extension of life and the extension of quality of life for a pet that has like that bad pain or
for sure.
seizures.
Yeah, I can do that. So another area that I've seen it work very well is particularly quality of life, end of life stages. So being a mobile veterinarian, often I see patients kind of in their sunset years. They're at home, they want to have euthanasia done at home when it comes to that. And to be able to provide them with the proper pain management at that stage in their life, I think what's important is you're often dealing with maybe kidney failure, liver disease, a lot of different things that if you throw a pharmaceutical at it, for example, a cat that has kidney failure, you cannot use an NSAID or a non-steroidal because you'll damage their kidneys. So an option that would be safe, and that I've seen from people that have already used it, would be something like cannabis in the CBD form, in the sense that it seems to not interact in a poor fashion, or it's not contraindicated like some of these other pharmaceuticals. So to provide them with that comfort and pain management moving forward until their end stages of life, I think it's very important for people to want that for their pets.
Do you have any pets?
I do.
Right. And if you had pets in chronic pain, what would you do?
I am certainly very supportive of integrative medicine. I think it's important that both things come together. So the use of, say, alternative methods along with Western medicine, I think they can really complement each other. So I think that I would choose if it was a protocol or a product, it would be something that would have the least amount of side effects or detrimental effects for the animal. There's certainly a need for pharmaceuticals in certain areas, but it's finding that balance. So how do you complement it? And that's another great thing I find from what I've seen with cannabis and the CBD, is that you can use it with other things. You can use it on its own. Mm-hmm. And giving people options is key, because not everybody wants to go one route versus the other. So CBD in animals can be used for various ailments. So everything from an anti-seizure medication, there's been benefits shown for an anti-inflammatory, chronic disease. You're absolutely right. They do come to me and they ask for, what are my options? traditionally we have pharmaceuticals that we reach for, different categories from non-steroidals to opiates, but more commonly now they're really wanting to know more about alternative options. So one of them is CBD and cannabis and the benefits for their pets.
So if I bring in my dog and it's got arthritis or hip pain,
Right.
what are you as a veterinarian allowed to offer me?
So currently, I realize that in Canada the laws have changed with the new Cannabis Act. Veterinarians have not been included in this up until now. We're certainly trying to advocate for it. But what's happened is our college, the College of Veterinarians of Ontario, has not allowed us to speak about cannabis use or prescribe it at this point. Reason being, there are no legal pathways for us to be able to prescribe that at this point because there's no products that are